Hi, Dr. Michael Miyazaki here, and I am excited to be here for the next two episodes. And I've titled this Patients Say No to Treatment Until You Do This. So, we're going to talk about a gamut of things going on in the industry. And I think it's really important, especially with AI coming into every industry there is out in the world today. How do we industry navigate that? So, I'm going to show you where we're getting to. There's some big changes that hopefully we can announce soon where we've got all these different AI products and services that we use within our profession. And now there are companies that are trying to envelop everything to kind of make it more manageable. And so I think of it kind of like the software that we use. Before we had a lot of different softwares. We had spreadsheet softwares, we had word processing softwares, PowerPoint type of softwares, and then we had to have something that kind of brought it all together. And I think in the dental industry, that is beginning to happen. But even larger yet, in the healthcare industry, medicine, dental, every other industry in healthcare is being uh, tied together. And so I hope in the next few months we'll be able to talk more about that because I think that's one of the very exciting developments that are coming about. It's not that AI is going to make our life harder. It should actually make our life easier. And then the other fear is AI going to replace us? Well, if you know what's going on with AI, you can anticipate where AI is going to go and you figure out how you can work with it. I think it is going to make your life easier and it's not going to replace you. So, what we're going to talk about today is how do we get patients to say yes to treatment? One of the things that every month from our marketing company, I get a report. What is the cost of the patient acquisition? What is the pay per clicks? What are we paying for our marketing? And you get all these different types of numbers. I was talking to a friend yesterday, and he recently retired, but he's passing his practice on to his son. And we were talking about how before dentistry was so different. We would just go in, do our clinical procedures, take care of our patients, and the business kind of took care of itself. When I started, we had a yellow page ad, and that was our marketing. We might do a couple donations to our neighborhood organizations just to kind of keep our name out there, but that was about it. We could really focus on taking care of our patients. Even HR back then, I'm in California, so HR in California is very tedious, but even HR wasn't as difficult as it is today. Today, the industry is more competitive. How do we find people to work with us? But how do we find the patients? So what is frustrating to me is when we spend the money to acquire a patient, just a phone call or an inquiry, and yet we don't get that patient into our office, or maybe they come in for a consultation and we don't maintain that patient within our office. So we try to do everything we can to set ourselves and our patients up for success. And I think that's what I'm going to cover in the next two sessions. So in the next slide, when we talk about our vision and our practice is to bring smiles and health to everybody. And I think for a lot of us in the dental profession, that's what we would like to do. But what if the biggest reasons patients delay treatment isn't because of money, isn't because of fear, or even denial that they have an issue? Because a lot of times when the patients come in, they schedule an appointment with us in our practice. They know that they have an issue. But the fact is that they simply cannot see or understand that problem. And if they don't understand the problem, then they don't trust us. If we say, hey, you've got 5 different problems, and they go, well, I don't have a problem. I don't understand the problem you say I have. They don't trust us, and they're not going to say yes. And if the solution to those problems is something that they anticipate could hurt both themselves and their pocketbook, maybe that will hold them back. So what we're going to cover in the next couple of sessions is how do we show them what's going on? How do we explain that to them? How do we build their trust? And then how do we provide a treatment solution that they're not going to fear? So this is a slide I've used in previous presentations. Just saying that communication helps to develop understanding and that trust, and then it helps us succeed. But what I'm going to do today is I'm going to embellish that a little bit. We have to have effective communication. If I'm here talking to you and I don't move you or make you think about anything, that's not effective communication. It's just communication. If I don't help you understand things better, so when we talk about understanding, if I don't help to create a better understanding of what you had, then you're not going to come back to listen to another program. And I think what you have to understand is as I'm communicating and increasing the understanding of what it is I'm trying to communicate to you about, hopefully that increases the trust and takes me back to hit that like or subscribe button so you don't miss another episode. We're almost to that 1,000. We're like within a hand's count of 1,000, and I want to get above that. So if you wouldn't mind, just hit subscribe just to be sure that you don't miss the option to listen to another episode of the programs we bring to you. All right. Now, when I graduated from dental school, I thought, wow, this is great, right? Maybe I don't have to use a rubber dam anymore. Maybe I don't have to do those long, lengthy, comprehensive exams anymore. And there were a plethora of things that I thought I was kind of escaping from. And then you realize it could be a week later, it could be years later that, hey, there were some really good things that we used to do in dental school that maybe I should go back and reinstate. One of those things was a comprehensive examination. So what I did is I kind of got away from that. You know, it was in the real world office situation, a patient would call up and say, hey, I just got my dental insurance. Can I come into your office because you guys are close to us and get my cleaning and have, an examination? And the office would say, sure, come down at 8 o'clock tomorrow morning. The doctor will jump in towards the end and take a look at your teeth for you. And the patient say, hey, sounds great. Very efficient, right? Today it's a little different. In our practice, because we are not contracted with the insurance company, we don't get a lot of patients calling us up saying, hey, I just got insurance, I'm going to come see you guys. We do, but not as many. And then a lot of times when they're selecting you, you're not necessarily the office closest to them, but you're the ones with the best social media reviews, right? So they're looking and weighing all that out. Then what we have to do is when we do this comprehensive exam, we really have to walk our patients through the exam. We don't just go through and say, well, you've got a cavity here, gum disease here, and not show them anything, not explain anything to them. What we do is we try to tell the patients, this is what we're starting with, and this is what you said you wanted to kind of accomplish. So in order to deliver everything, so it's win-win for everybody, where I take care of your clinical needs so you're not getting a toothache, and so that you get the smile perhaps that you want, these are things we have to do, right? So we have to come up with an understanding of what are the next steps. And I think as we do this, we're building that relationship. So before we even meet the patient kind of checks us out, right? They go to our social media page, they're looking at our website, and then many times a day, they're not calling us up to make the first touch with our office. It's actually maybe a text or an email or an online form that they're going to. And so it is a lot harder, I feel, to develop that relationship. And then when they first walk through the door, typically they're not going to meet me, but they're going to meet somebody on my office team. Aesthetics is still a big thing. And I go through this just because this month, actually, we're going to be teaching some live patient treatment programs. And I just keep emphasizing to the doctors that attend our programs that when they do these surveys, and there's thousands of people that they survey, still more than half don't like their smile. So what we have to do is we have to make sure that we address that, because people that are doing programs like this are online. They see their smile more often, and a lot of people feel anxiety just when they do their Zoom calls. So really quick, what's comprehensive mean? To me, that means treating the whole person more than just the teeth. So we have to get to know the person. We need to understand what's going on with their body. We go through the medical history, we go through the dental history, we go through a TMJ and airway to figure out what's going on with the entire body, not just their gums and their teeth. We have a form that asks them what are some of their concerns, like what do they want to accomplish? Because if I just say this is what you need clinically, this, and this, and I never take care of the fact that they maybe want whiter teeth or they want a nicer smile or straighter teeth, then I've kind of let them down and they may not come back because of that. But of course, we look at the gum health, the periodontal health. We look for the endostatus. Are there any surgical needs, third molars, broken teeth? Ortho, perhaps. We look at the restorative state of the teeth. Is there decay? Are there restorations that are needed? Are there missing teeth? Okay, now let's look at the joints and the muscles. Let's see what the occlusion looks like. We do an oral cancer screening just to be sure that there's no lesions that we miss, because we don't want anybody under our watch getting oral cancer if we can help prevent that. As I mentioned before, we look at the medical conditions, medications, what kind of stresses of the body is their body under, and then we look at the aesthetic concerns. And so sometimes I talk to dentists, or in the past I have, and the dentists have said, well, aesthetic concerns, that's more vanity than anything else. And I tell them, no. Our patients today with social media know what patients can deliver, how we can improve their smiles. And so they may come to us not because they have a toothache, but because they have aesthetic concerns. And I think if we miss one of the things that are on this list, then we've kind of failed our patients. If the patient comes in because they fill out an online form and they say, hey, I want to come in because you do veneers, and we look at that and we go, okay, we could do veneers for you, but they've got endo abscesses or oral cancer, then we fail them. Or if we say, hey, you have some caries we need to take care of and we need to do some interproximal restorations in your front teeth areas, and we fail to realize that they actually want veneers there, then what might happen is we take care of the decay, and then they come back to us and say, okay, well, now that we've taken care of the decay, how do I take care of my smile to be the way I want it to be? And we go, oops, we could have done that with just veneers, I guess. And so we don't want to do that to our patients. We do want to listen to them. So we have a lot of forms. We ask our patients, do they like the appearance of their smile? Do they like the alignment of the teeth? Are there spaces between the teeth or color issues with the teeth that they don't like? Is there the shape of the teeth? Because are there worn areas of the teeth where their teeth maybe are chipped or hidden? Teeth that are in lingual version may not be able to be seen when they smile. Is there a lot of wear and tear going down the teeth? We get more patients concerned about the wear and tear that are actually quite young still, which is good for us, that the patients are asking us to take a look at those things earlier than later. Are there any old areas of dental work? Somebody might have old amalgam fillings that they don't like to look at. They want them replaced. I always tell the patients, clinically, there's no reason to replace it, but aesthetically, if you want to, it could be done perhaps. But I don't make that decision. I let my patients make that decision. But we're asking them, why are you here? What would you like us to do for you? Then we ask them the TMJ questions. Do you have clicking and popping in your jaw joints? Do you have head pain? Do you have migraine type headaches? Do you have neck pain, vertigo, dizziness, ring of the ears, tingling of the fingers, difficulty swallowing? Do you clench or grind? Do you have difficulty finding a comfortable bite? Do you have limited opening of your mouth? Or do you have a feeling of pain or pressure behind the eyes? And we ask our patients all these questions. So then what we're basically going to do is we're going to take our observations from our comprehensive exam. We take the things that are pointed out by our patients from these forms, and our treatment recommendations are just to bring them solutions. So the patients are sharing their concerns, and then we just ask them, so tell me, what does this mean to you? What I hear you saying is. So then help me figure out why this is, why you have so many cavities. Okay, great. Now we're going to do that clinical exam. So, we go through these forms, then we do the clinical exam, and I just tell the patient that this helps us establish a baseline. And then as we go through the exam, if there's anything that's significant, I'll explain it to you. But if you hear us say something or you have any questions, stop me and we'd love to answer the questions that you have. If it's okay with you, once we get all this information together, the ideas of the things you'd like to accomplish, we will sit down and present all of the thoughts to you. Is that okay? So we get a permission, we use a permission statement to get permission from the patient to just share everything that we find, because we want this to be beneficial to them, right? We don't want to leave any stone unturned. So as we go through, we do our examination, we do the perio, we do the resto, soft tissue, teeth, occlusion. This is just a form that I've been using for the past probably 25 years. And we just go through all this. It looks like a lot, but it probably takes us 10 minutes to get through. So again, we just tell the patients, today we're doing a comprehensive examination so we can establish a baseline. And, our patients are typically with us 20, 30, 40 years. And so we use this information to establish where we're starting our relationship. And then if things change in 5 or 10 years, we have a way to go back. I'll explain the things as we go. Then with your permission, as I mentioned before, we'll address your concerns. I'll show you what we see, what may need attention, and then what options we have to avoid bigger problems later. How does that sound, right? So what we're trying to do is we're trying to get the patients to understand what is it they need, why we're making the recommendations, and get them more likely to be receptive. So we create this receptive patient, and then in our social media or our reviews, we want to see the patient say, this was an outstanding examination that they received. The comprehensive examination should include, again, what the patient's concerns are, what the clinical situation looks like, what it looks like when we assess their medical and dental histories. Again, take a shade of the patient's teeth If they're A3.5, explain to them that your teeth are an A3.5, just like your pair of pockets are twos and fours. And then ask the patients, do you like your smile? So what we want to do is from this examination, we build a relationship, we develop a plan. That plan may have to be done in phases. What we're able to do is give the patient a financial estimate of the work. Sometimes we have to break that work up into those phases and then make sure the patient understands everything. It's just like right now. We've got a home that we would like to have repainted. I have no idea what it costs to get my home repainted. So now we've got a couple of estimates on what the repainting is going to be, but some of the estimates include removing some of the siding and then adding Setco and then painting. So we have all these different options. But one of the things that I like is now I have tools to work with, right? Now I know how much money I need to have the work done. I can select what work I want to have done. Whereas, if I went in there blank with no information, that's like analysis paralysis, where I'm just fearful of the cost because I don't know what options I have and I don't know what the costs are. So I'm going through this all the time too, and I tell my colleagues this: if a patient doesn't say yes right now, that's okay. They came in, now they trust you, but now they've got to make some plans, sometimes adjust things so that they can afford to pay for that dental work. And aesthetics is just part of that puzzle. So aesthetics is a part of everything that we do. It's a part of everything we do, from composites, indirect restorations, dentures, and implants. A lot of times we want to fill a space that's edentulous, but we have to make sure that what we fill it with is something that looks aesthetic, especially if it's a front tooth or an aesthetic area. I'm in California. I had a patient last week call from Boston. She's coming all the way from Boston to get her teeth worked on because nobody in her area can do the work, I guess. And so we had our Zoom conference call, and this patient's going to come all the way over and let us look at the possibilities, give her an estimate, and then possibly treat her. So people want that relationship, and they just want to know what it is that they're going to have to do to get the work done. What I think of this is we're creating value. And if we go to things like periodontal disease, I've often heard there's really no cure, but periodontal care will fail if the patient can't see the problem. If they can't see the problem, one, there's no value for them to actually take care of the problem or try to treat the problem, but there's no way they know if they're treating it well or not. So when they don't see it, they don't value it. And if they don't value it, then it's really hard to get a patient to say yes. So I've talked to you about this before, but we use what's called the CubeList system. It's just using a blue light source. It's 405 nanometers. Goes through a filtering system so we can see areas where the enamel is demineralizing, where the biofilm is building up, and that biofilm I'm able to show the patients. And this just isn't any biofilm, but this is biofilm that's usually 3 days or older. So if they don't brush their teeth for a day and they have plaque there, this isn't going to glow red. But as soon as that biofilm starts to get to 3 days or older, the porphyrins created by that biofilm are going to start to show with a red glow as it's filtered. And the way it looks is biofilm is either kind of red or orange, so that shows that there's the presence of bacteria. Then we've got healthy enamel that will show up as green fluorescence. And then decalcified areas in dentin often show up kind of white. The decalcified enamel areas will show up kind of with less of a shininess because it's demineralized. It's a little bit more dull, right? But the dentin will actually show up white. So if I'm looking at occlusal wear on the occlusal surface of a molar, you'll see the green enamel with the white dentin in different areas. So what does the CubeList show? The biofilm, which is the bacterial buildup that's 3 days or older, that leads often to gum disease. And if it's interproximal, that can lead to decay. If it's around orthobrackets, can lead to decalcification and decay. So we can see enamel weakening, demineralization. It helps us see cracks and fractures in teeth because as the fractures get big enough, bacteria can get in there and that biofilm will glow red. We can actually see leakage under restorations. I've had Emax crowns that I light up with the CubeList and I see red. I see veneers light up red. And when I remove those restorations, I see the micro leakage that's been going underneath that restoration that I could not see from the outside. So there are these very subtle changes that a standard dental exam might miss that the CubeList system helps us reveal. And the way that I look at this, and I tell the patients, I go, the CubeList reveals tomorrow's problems today, but actually tomorrow's problems in a more minor way, right? In a way that we can actually prevent from turning into a full-blown problem because we know that it exists. And so this was an example I've shown in previous YouTubes, but if I tell Mrs. Patient, you have a lot of biofilm, you have plaque, you have gum that's going to lead to gum disease and possibly decay, and I'm looking in the patient's mouth and they're just hearing my words, it looks like this blank screen. It doesn't really move them. They don't understand it. And when I say you really need to brush and floss, they're like, okay, but why? So our patients have these large wounds, overall health. It's making their blood stickier that can cause strokes and heart disease and so many other things that we see today. That the oral systemic health situation can be linked to or associated with other systemic diseases, but they're in the dark. So what do? Is we pull out our intraoral camera. With the intraoral camera, we show them what's going on. See this white stuff down here right at the gum line? That can cause cavities, that can cause gum, bone loss, gum inflammation. And again, the patient looks at these photos and says, well, what is that, right? It takes a while to decipher, okay, that's porcelain with something brown on the top, that's a metal collar, and then root, and then gum. They're trying to understand all that while we're telling them, so see all that plaque that's there? That's where the problem's going to arise. By the time we are done, they're starting to process it, but again, they don't see the problem. And I think that's one of the reasons why they're not moved. But when we use the CubeList system that glows with the biofilm, shows all the red, now the patients are like, wow, that doesn't look right, right? And we tell them, or even before we tell them, you have a lot of biofilm, they're asking, what do we do? What do I do? And so now we explain to them that we want them to brush and floss, or maybe they use a pair of protect trays because that will help to control the biofilm. So with the words, they see nothing. With the intraoral camera, now they see the stuff, but do they really understand it? And when we show it to them in the red, they're like, okay, great. What do I do now? What we're trying not to do is we're trying not to sell dentistry. We're just trying to create clarity. If the patients understand what's going on in their mouth, they're more likely to understand and to accept treatment. We're going from something that's abstract, I can't see, I don't understand, to something that's visual, like, okay, what do we do? And that's just what the CubeList does, right? On the upper white light photos, it's hard to see the plaque. Imagine trying to show the patients that plaque. Imagine trying to use retractors to show them. It's not easy to do. But if we're going to should be able to show them where the red is, now we can show them, this is where I want you to take care of. See how on the cheek sides of these teeth, right at the gum line, there's a lot of red. That red's going to cause gum disease. It's going to cause bone loss. It's going to cause decay. I need you to help me take care of that. And this is what we need to do. So, it's not about blame. We're not telling the patient, hey, you're not doing a good job. What we're doing is we're saying, I understand you're trying to do the very best you can at home, but it's really hard. When you can't see what it is you're trying to take care of, it's really, really hard. And if you can't see it, and you can't take care of it, things are just going to get worse. And that's why last year we had to do a root canal tooth, or that's why last year that crown came off, because there was just a lot of decay up underneath there. Our role is to help you see it early and then help you to control it. So what we're going to do is we know that these areas, because we've identified them now, are going to be problem spots. They're hot spots. And what we're going to do is we're going to help to prevent problems from growing. So the color resonates with our patients. It helps them understand the diagnosis. It helps us make a better diagnosis because we can see better. And now the patients value what it is that we're recommending. Oh, you're right. I can see there where that red is. Yeah, we need to try to get that off my teeth, right? Right. And in the long run, you're going to increase your revenue in your practice. Because I know some clinicians are like, well, why do I want to stop decay, or why do I want to stop gum disease? One, because it's the right thing to do, right? There's always going to be enough patients to keep you busy if you're doing a good job. And it's going to help you keep patients within your practice. Because remember, I talked about before, your patient acquisition costs are high these days. So I don't want to lose a patient and then have to find a new one. It is always more beneficial if I can keep the patients that I have. And then the patients don't second guess us. They don't say, well, how do I know you're telling the truth? Because I've shown them the truth. I've shown them what needs to be done. And we just tell them, hey, you know what? If when you use this technology or when I use it in our office, if it shows red, that's an area that we have to act on. So we're going to guide you. We're going to illuminate these hidden issues, treat them smarter, treat them faster so you don't have problems like that. Because again, it's the kind of philosophy we've developed in our office is today we need to build that trust, educate, and motivate our patients more efficiently and effectively, right? When I first started in private practice, we had hygienists and they would be with us for 10, 20, 30, sometimes even more years. And so there's the same old hygienist, not to say that our hygienist was old, but the hygienist that our patients became comfortable with and they saw for years and years and developed this friend relationship with, we'd walk in the operatory and the hygienist would say, you know, we've got this really large MODBL amalgam over here, and I've explained to our patient that that might need to be restored, possibly with the crown, so could you take a look at that and see what you think? By the time we walked in, we'd say, yeah, you're right. That restoration has leaky margins. We have cracks running between the natural tooth structure. Yeah, you're right. We need to put a crown on that tooth to keep it strong so it doesn't break. Patients would just say, okay, when can I come back and have it scheduled? Today, we don't have old hygienists. Unfortunately, a lot of our hygienists, maybe they're with you a couple of years and they cycle through, they move, or they find a better paying job, or they go to another type of practice where the benefits could be better. We have a lot of new patients coming through today. Remember, they're finding us through social media. They don't really know us. They weren't referred to us by a friend or family member, but they know us virtually. And then the time is short. For a lot of practices that are very busy, they can't spend a lot of time with every patient. So I think that's why this technology is really helpful. You know, it's like cameras and intraoral camera technology that most hygienists, doctors, and assistants are really used to using. And now the patients who didn't know what they were seeing can understand it faster because the color resonates with them. And I think it just becomes part of our workflow. And I call that stepping into dentistry 2.0. And I'll explain that to you in a little bit. So CubeList makes invisible disease drivers visible because now we can see. It shows tomorrow's problems today and allows us to communicate more effectively, more efficiently, and to increase the understanding that the patients have. So we spend less time educating, and we can, if we use ParaProtect trays, we have more time now to get the trays and the gels delivered. And that's how we increase our revenue. So what is dentistry 2.0? Well, the dental industry, I think, has gotten it wrong, or maybe we just haven't adapted well. We've been very reactive, right? We wait for the disease to develop, then we remove the disease, we restore that diseased area, and we have to document it. And insurance required us to do that. If we saw something that wasn't documentable, like, you know, we take a bite wing x-ray and we might be able to see visually between two teeth where that decay is, but our bite wing doesn't show it. It's risky if we do that restoration, right? Because we tell the patient it may not be covered by your insurance, but we don't want to wait, right? So we try to tell the patients, let's do that restoration now. It may not be covered by insurance, but it's sure going to be a lot easier to do now than if we wait for it to get bigger. So our patients today will actually pay for it. They want something different today. They want to stay healthy. They want us to help them prevent problems, not let problems persist. So we're not going to repair everything. What we can do is we can show you where tomorrow's problems are most likely to occur. We can give you some solutions so that those problems don't develop into something where we have to numb you up and drill and put a restoration in. And I think by working with our patients, that is proactive dentistry that many of our patients today prefer, and I call that dentistry 2.0. So, Mrs. Patient, we can show you today where this tooth problem is developing. And do you understand why that's not good? Okay, let me help you understand how we're going to prevent this. And it just becomes so much easier. Mr. Patient, the reason why this tooth is hurt when you've been biting on it is because there's a crack. Now, I know on the left-hand white light image, it's hard to see that crack, but on the right-hand side, when we use this new technology, we can show you where that crack is because that crack's big enough for the bacteria to get into. So biofilm doesn't discriminate. We can use this on young patients, older patients, patients that are anxious about seeing the dentist, anybody, because it's just a very comfortable way to show the patients what's going on. Ortho patients that are not about brushing around all the hardware, we can explain to them, see all that red around all those brackets? Not a good thing, right? Because that's where you're going to have decalcification, white spot lesions. So this technology is non-invasive, very comfortable for our patients, and that's why even for young patients or those that are very anxious about going to the to see a dentist, it's not difficult for us to use this technology. There's no poking, there's no prodding. It's very simply just a handheld light with a filter that makes it ideal to educate our patients, whether they be young patients like children or senior citizens in care facilities. This technology can be used to help us explain to them what treatment needs to be done and also to monitor it. Now, part two in this presentation is showing how we use this information and some of the more minimally invasive treatment options to make this a win-win. So come back. Remember, hit subscribe, hit the like button. We're trying to create a community of like-minded clinicians who want to do the very best for their patients through working with their patients, doing great ethical, minimally invasive treatments for their patients, and grow their practices. That's the name of the game. All right, I'll see you during the next episode. Thank you very much.